The following is a live recording of the Brandon Systems COVID-19 Health Screening Tool, featuring an automated CDC LTC Respiratory Surveillance Form and Summary, as well as an automated employee or visitor attestation tool.
Good afternoon. My name is Janet Blagg, and I am the Director of Solution Delivery here at Brandon Systems. I want to thank you for taking time and joining us today. Firstly, I do want to let you know we are recording this session, so it will be available after our webinar. Additionally, you are welcome to use the Q&A section on the lower portion of your screen to ask any questions throughout the demo today. Where we can, we will stop and answer your questions live, and where we do not have time, we will send a complete Q&A to each of you after the webinar. Now, I know that you all are very busy during this crisis, and I assure you will be as brief as possible in our presentation, and we hope that what you see today will be helpful. With the added measures implemented on long-term care facilities, we do understand your everyday work routine has changed. You don't have to assess and report COVID cases, but you also have to screen anyone who needs or wants to have access to your facility for any reason. So the intent for this application you'll see today is to help you get this done efficiently and in an automated and organized fashion. Firstly, I want to introduce you to Brandon Systems. We have been working to improve technology in the healthcare industry since 1974. We do work closely with our customers to understand their business and design solutions. We have a few technology healthcare services we provide on your screen right now, and below that are a few of our clients. Now, the meat of why we're here today. This is why you are on the webinar, and we thank you very much for joining us. When the COVID crisis first started, our CEO asked us what we could do to help. So we asked our clients and our partners and our team members to come up with ideas and see where we had opportunities. While keeping a close eye out on all those recent changes by the CDC and the current administration, we decided that enhancing our ClearVue case management tool would be best and most efficient. And we wanted to assist all the local health organizations and facilities who are now tasked with tracking and reporting, following up on, and just dealing with the day-to-day, what's going on with COVID in their facilities and with their patients. We heard many of you guys are doing this manually. You're using spreadsheets and documents. We saw the toolkit, which is a plethora of PDFs. All of this can be time consuming and it can lead to errors. So we hope what we share with you today will be useful. So direct from the CDC key strategies to prepare for COVID-19 in long-term care facilities, we developed a tool to help you assess, manage, and follow up on the COVID cases in your facility, as well as screen those coming into your facility to ensure the health and wellness of your staff and patients is maintained. We believe that this new regulation imposed on all long-term care facilities and nursing homes will be the new normal. This isn't just a COVID tracker we're sharing with you. This is actually designed based on the LTC Respiratory Surveillance line list there that you see on the left side of your screen. So this enables you to track the bacterial and viral infections like Legionella, RSV, flu, and it's simple for us to add any other respiratory illnesses which you would like to have tracked and recorded. Also in the demo today, we're going to be sharing with you the Employer Visitor Attestation tool. This is going to help with your employees and your visitors to do self-attestation assessment of their health. It will help prevent exposure, we believe. It will affirm for you that you have a healthy workforce coming into your facility, and it will help you track and report who's coming in and what their health condition is. So with no further ado is the demo time. Today we have Bob Rice on. He's our VP of Client Services. He will be the voice that comes in and lets us all know if there has been a live question asked, and we'll get a response from Bill Sloven, our VP Product Development. He will be the voice that you hear throughout the demo. Jenna De Cordova, our product specialist, is on, helping drive the demo in the background. So with that, I would like to introduce you and ask Bill Sloven and Jenna De Cordova to get started.
Great. Thanks, Janet. So what we're going to do today is we're going to demo for you the long-term care surveillance line list application and we're also going to show you the employee and visitor screening application. So what you're looking at right now is our ClearVue portal. This is the entry point you would utilize for your staff to get into the various dashboards within the tool set. So Jenna's going to log in, and that will take us to the main portal screen. And you'll notice that one of the dashboards listed there is the long-term care respiratory surveillance dashboard. Whatever you see when you log in is driven by security. So depending on the type of user, you can show them different dashboards. This is the one for the LTC surveillance list. So what we're looking at here now are all of the cases in the long-term care facility that currently have been tracked as a potential respiratory issue. So this could include both residents and staff members. And as a new case is identified, you can create a new case. You'll see that all of these fields across the top are sortable. And for example, you can just click on the sort button and it'll resort the data. And what we see here is we see the name of the person, we see some demographics about them, their age, their gender, whether they're a resident or a staff member, what kind of stay, what floor they're on, what room they're in, and also the date of the last assessment. And as you assess people, we keep a history of all the previous assessments. So at any point in time, you can look at when you last assessed that person, because what you're seeing here is the information about the most recent assessment. So we can sort that field and we can use that as a trigger to know, hey, I haven't assessed this person in a certain period of time. I need to do a reassessment of that person. So what we're going to go do now is create a new case by clicking the Create New Case button. And that'll pop up a form where you can fill out the basic demographics about the person, their name, their date of birth, their gender, and then whether or not they're a resident or a staff member. Depending on if they're a resident or a staff member, it'll ask you for different pieces of information, like what building they're in, what room they're in, or if they're a staff member, what floor they're assigned to. So we'll just go ahead and fill out some fields here. And then move on to the next section where we indicate the symptoms. So we can indicate when the symptoms started, and that's just a simple date field. And then we can indicate what symptoms the person has. And all this information, again, is tracked and available in the back end. And you can see historically how the symptoms have changed. You can see what the previous assessments looked like. We have the ability to specify additional symptoms that may not be listed on the form itself. And then we move down into the diagnostics area where we can indicate what kind of diagnostic testing has been done and whether or not any pathogens were detected during any of that testing. We can indicate the date of collection, and then down below, we can indicate any bacterial or viral infections that the person may have tested positive for. And then finally, at the very bottom, we can indicate the outcome. So maybe the person's symptoms were resolved and they've gotten better, so we can indicate the date of that. We can also indicate whether or not they were hospitalized or if the person was deceased. And then we can also indicate whether or not this is considered a case according to CDC guidelines. So lastly, we'll just go ahead and submit, and this is going to now add another person to our list here. We'll see that their last assessment date is now 5/7 at 4:09 p.m. And then we can go and reassess this person. So if a week from now we say, hey, we're going to go reassess how they're doing, we can add another assessment record just by simply right-clicking and click Add New Assessment Record, and it'll pop up the latest assessment, and we can now go in and make any adjustments. Maybe their symptoms have changed. Maybe they have additional symptoms, or maybe some have gone away. You can indicate that here and then save that. And at any point in time, you can get back to that previous assessment. So we'll go ahead and submit. That'll now update our current assessment, but we can also right-click and we can view the previous assessments. And that will show us all the information for all the prior assessments. We'll see the one there that was entered at 4:09, and then the subsequent one at 4:10. Okay, and then lastly, from this dashboard screen, you do have the ability to export the data into the CDC format. So you'll notice up at the top there's a tab that indicates CDC LTC surveillance line list. So this layout here, this format, matches up with the CDC form that they provide, and it includes all of their coding that they define for all of the different signs and symptoms and diagnostic tests. And this can then simply be exported. One of the things about our ClearVue platform is from any one of these screens where you see data listed in a grid, you can simply click on the cog that Jenna just clicked on up there, and you can export the data. So she's going to go ahead and click that little print icon, and we can then download the data right into Excel. And that would then give us the option to download a file, and it would open it right up in Excel, and you could then use that file to either send it directly to the CDC, or you could manipulate it if you need to, add any additional data fields that you might need before you send it out to the CDC. So that covers the surveillance application. The idea is for it to be a lightweight type application where you can add cases as they come up in your environment when there's any kind of an outbreak. So now we're gonna flip over to the employee and visitor screening application, and I'll show you how that works. Okay, so what we're looking at now is the screening application. And the idea behind this application is if you've got employees or you've got visitors who are either frequently visiting your site or periodically visiting the site, you've got guests that come in, you have the ability to have them attest to their health. And what they do is they simply bring up a website. This could be linked to from anywhere. And on this web page, they would fill in some information about themselves along with some symptoms and whether or not they're healthy. The idea here is they could do this either from home on their home PC, or they could do it on their mobile phone when they walk into the facility, or if your site does have devices at the facility, they could do it there as well. So I'm just going to go ahead and fill this in. And I'll indicate what type of person this is that's entering. Let's say I'm a visitor, and I'll click proceed. And it'll then take me to the next screen where I can indicate my current health status. So I can indicate my temperature. Let's say right now I don't have a fever. If I did have a fever, it would actually ask me when the fever started. But let's say today I don't have a fever right now. Any symptoms I might have, any pre-existing conditions, and then whether or not I've been exposed to anybody at risk. Have I traveled to any high-risk countries, or have I been exposed to anybody that may have had COVID-19? I'm just going to go through the case where I don't have a fever. What'll happen after this, once I submit, is it's going to tell me that I've done my self-screening and I'll be emailed an admission code. So what this actually does is it sends me an email, and this is what the email looks like right here. And in that email, there's an admission code attached. And what that admission code is a QR code. This is a barcode, essentially, a three-dimensional barcode that can be scanned on a device like a phone. And then from there, we can look at the results of that assessment. So what would happen is, once I get this code, let's say I did my screening at home, I could print this code out on a piece of paper, or I could take the email on my mobile phone and bring it into the facility and show it to the person at the door. And they would then scan it. And I'll pull that up right now and show you how that works. I'm going to actually scan this on my mobile phone, and you'll see exactly how that process can work. So here's my phone. This is actually the phone that I'm using. I have it in my hand right now. And I'm going to bring up the camera, and I'm going to scan this QR code, and you'll see it popped up asking me to open a website, and that's going to bring me right in to the screening application and show me the status of this person's screening assessment. And you'll see there's all my information, and I can then make a determination as to whether or not we need to do any additional screening on this person, or whether or not I can admit them. And essentially, it allows you to get a really quick assessment of their health, and then be able to admit people quickly. Lastly, the other capability you have is there's a dashboard where you can see all of the cases that have been entered into the system. So all of the people that have visited your facility, you can see them on a dashboard. So here I am back in the ClearVue portal, and you'll see there's a dashboard here called the Employee Screening Dashboard. And from this dashboard, I can see all of the people that were at urgent risk level or moderate or low. I can see when they checked in, so I know that they accessed my facility, and I can see some various information about them. Additionally, all the information about their screening, their health assessment is also stored in the back end, so that can be utilized if necessary for any kind of reporting. And that covers the visitor and employee screening application. With that, I'm going to turn it over back to Janet, and she's going to wrap us up and bring up a few more slides.
Thank you, Bill. So, comes down to costs. So we wanted to share with you our affordable pricing. So there really are no setup fees. This is a web-based tool. There's no base fees, no cancellation fees, no long-term contract. This is done by the amount of staff and the amount of residents that you have. So it's very scalable towards your needs. You can have as many as one admin seat, you can have more. What the admin seat is that's the capability to use the dashboard, to print out the reports and to manipulate what's going on in that dashboard as needed. So the employee visitor attestation tool, that is that top level pricing. The health screening tool, that is just a complete tool. The health screening LTC surveillance was that respiratory surveillance form you saw. That is just a standard fee. So over to the right, we did a little calculator for you based off of 50 staff, 100 residents. You wanted 4 admin seats, and you wanted both the employee visitor attestation and the health screening LTC surveillance. That would be the cost. If you do sign up, I know we said no long-term contract, however, if you do sign up and prepay for a year, you do get 1 month free. If you are associated and are a non-profit organization, we do provide discounts for that. So that concludes what we have to share with you today. We want to thank you very much for joining us, because again, you guys are the front line. You guys are taking care of folks. You're in front of the individuals who need you the most, and we really appreciate that. That hits especially close to home to me. So if you have any questions or you want to get started, please reach out to me personally. This is my email and this is my direct line, and we look forward to supporting you. Thank you again for joining us, and have a great day.